Hi, I'm Dr. Jason Hafron, Chief Medical Officer at the Michigan Institute of Urology. Today I'd like to talk to you about the Abdallah et al. Trial that was recently published in the Gold Journal of Urology. This was a very interesting trial that looked at longitudinal data for the IsoPSA blood test. IsoPSA is a blood test that's used for men with elevated PSA greater than 4 and men who are greater than 50 years old. This was an excellent trial from the Cleveland Clinic that looked at the use of IsoPSA in a longitudinal format. They looked at over 1,500 patients from 2016 to 2022 that had an IsoPSA test, and then they subdivided the patients in with patients with a normal IsoPSA versus patients with an abnormal IsoPSA, and then they followed them over time, collected all the data on their MRIs, on all the data on their biopsy, and what stands out about this test is that the IsoPSA result initially holds up over time. And that's really important as a clinician because that initial result will dictate or predict the future. Essentially, if a patient has a negative IsoPSA initially, they're most likely going to maintain a low risk of prostate cancer, 6% to be exact, based on the results of this study. However, if the patient has an abnormal IsoPSA, their risk of clinically significant prostate cancer, based on the results of the study, can go up to almost 50%. So the initial IsoPSA, highlighting the strength of this biomarker, shows that it is predictable or essentially durable over time, and that is very helpful when managing a patient, but also talking to a patient in the clinic. If they have a negative IsoPSA, you can be pretty confident, nothing's perfect, but you can be pretty confident that their likelihood of clinically significant prostate cancer is low, and based on the data presented, it's about 6% over time. If they have an abnormal IsoPSA, then my conversation with them might be different. That we'll talk about that we need to monitor them, that they're still at increased risk of clinically significant prostate cancer, and my treatment or my follow-up regimen will also be different. IsoPSA is a very helpful biomarker to not only predict clinically significant prostate cancer, but also to tailor my monitoring of these patients, whether they need intense monitoring or not intense or de-intensified monitoring.